Hello and welcome to Mental Health Matters. I'm Edgar Wiggins, your host for this program that's dedicated to providing you with practical and useful information regarding mental health issues and needs. Substance abuse is a significant problem in Baltimore City. Current estimates are that there are somewhere in the neighborhood of 60,000 persons living in the city who are addicted to illicit substances. Add to that the problems of alcoholism and the many other problems, and you have what seems like an overwhelming situation. We have with us today Dr. Fred Osher, and Fred is the director of the Center for Behavioral Health, Justice, and Public Policy. He is an associate professor at the University of Maryland School of Medicine and formerly with the National Institutes for Mental Health. Dr. Osher is here to talk with us about the issues related to substance abuse, addictions, and actually the crossover in terms of mental illnesses and mental health issues. Really this notion that we've talked about in the past as co-occurring disorders. And hopefully Dr. Osher will help us make some sense out of some of these complex and challenging problems. Welcome to Mental Health Matters, Fred.
Thank you, Edgar.
Let's start out by looking at why it seems to be so hard in this country, at least in my humble opinion, for people to really think of addictions and substance abuse as a disease, as an illness. Why is it that we seem to want to make it some kind of issue that somehow is punishable by imprisonment and all this kind of stuff, talking about people's moral characters?
Yeah.
I mean, let's kind of start out by trying to tackle that tough one.
Well, it's been a long road to gain credibility with a scientific base to support the disease model, and that many of our values around drugs and alcohol stem from a period in time when little was known, and particularly when the use of substances has such a rich historical history. So throughout time, people have always used substances to change the way they think or feel, and that it wasn't until recent days that we recognized that the overuse really changes the wiring in the brain, leads to some very significant and permanent changes in the effects of drugs and alcohol on the body, and that we've come now to appreciate that this is more than just a recreational activity. But I think that the attitudes and the myths are embedded in the social acceptance of the use of mind-altering agents.
So what you're saying then is that, I mean, often what we hear is that if I were a better person, if I had more self-control, if I were the master of my own ship, you know, I'd be able to control my use. And what you're saying is that there's some actual scientific reasons that drive people to use substances and that keep people using substances.
Clearly, and the data gets richer and richer as our technology evolves, and we do in vivo PET scans that allow us to see how substances of abuse light up different areas of the brain in people that have addiction than those that don't, and we have increasing genetic evidence of the predisposition and vulnerability of people to develop addiction. So it's, if 100 people used drugs, not all of them would become addicted, but there are some factors that would predict vulnerability in certain of those individuals, and it relates to their genetic inheritance, it relates to their attitudes and assumptions, and then there are these cofactors like the presence of a mental illness that create vulnerability for folks. So that it's important, when we consider kind of use patterns and abuse patterns, that we tease apart some of these risks that are there. The other thing that's a part that allows us to think this is something other than illness is that there is a period of time in which use doesn't seem to affect function, so that folks that will begin their drug use or alcohol use will, for the beginning phases of that, look pretty healthy to the outside world. And you'd have to say, well, they don't drink any more than I don't consider myself to have an illness, and therefore I'm not going to allow them to have the credibility that kind of comes with illness. But that's changed. I think another key factor in the change, too, Edgar, is that we now have treatment that works. In the past, we're kind of left with, well, what do you do about this? And when you really didn't have a technology available that could motivate people to change, to support the good choices people could make around drugs and alcohol, then you're left with any old theory about what the causes may be because the treatment was so vague. We now know that treatment works for addictions. If you can get people in, if you can teach them about the risks that are a part of it, if you can give them real facts around the real dangers that are associated with drug use, they can make better choices.
Well, one of the things that we had some guests on the show that have opened up a new detoxification program, primarily for people who are heroin addicts, and one of the things that they talked about was, in fact, that we are looking at disease, and one of the very negative outcomes is death. So that these are really significant risk factors, and we need to address them. Can you talk a little bit about treatment and what kinds of treatments seem to work?
Sure. And again, it depends on the drug of addiction in terms of what the medical interventions might be. And you had some good experts here talking about the real dangers of withdrawing and the management through detoxification, through the gradual withdrawal process that can be managed medically. But once you get past that acute phase, there is a long road, but a real road to be followed in terms of developing abstinence-oriented goals and choices. And that we understand that much of this work comes from the very real addiction of tobacco, where we look at how the habits of nicotine users evolve over time. And if you know anyone that's smoked, or more importantly, know anybody that's quit smoking, you come to appreciate that it's not an event. You don't get there by crossing a finish line. It's a process that you engage in. And the changes that happen in a person's motivation and their willingness to look honestly at the choices they're making can be pushed along by a treatment intervention so that I can work. We don't just have to let that addict experience failure, and there's an old adage that they need to hit bottom before
That's, yeah, we've heard that
possible.
A lot.
Well, we know now that that's not necessary. You can raise the bottom through some of these interventions that have them participate both in learning about illness, in recognizing the consequences of their choices, in putting them with peers that have struggled with this and made good choices and are in the process of recovery. And we know that if we can engage an individual, that is, if we can welcome them into a treatment setting, respect them for who they are, not condemn them because of the moral issues that you raised earlier, but really let them understand we see this as an illness, that if you keep an individual in treatment, more than half of them will, over a period of time, return to abstinence as a lifestyle and be on a long-term path of recovery. The other thing that's important about this illness, you know, if you have a pneumonia and you get infected and you take some antibiotics, done, gone, you've cured it. This isn't an illness that you cure. This is an illness that you control. And that's a key for this. So when we, in the addiction field, we don't talk about recovered individuals, we talk about recovering, which is, it's a process in which you have to be aware of your vulnerabilities, aware of your risk, and accept the fact that there's some chronic nature to the disorder.
Well, let's step back a bit, though, because one of the things that you talked about that has been a concern to me for some time, and you really talked about welcoming people into a treatment environment, recognizing where they are, and for a long time, one of the things that was conventional wisdom was the need to do this kind of very aggressive and assertive confrontation of addicts and substance abusers, and, you know, as we talked about before, as you mentioned this thing about they have to wait for them to hit bottom. That's very different than what I'm sensing in terms of the approach that you're talking about and some of the more current approaches that really do see this as a medical illness.
Yeah, that's correct. Now, that's not to say that some of the traditional approaches don't work with some individuals with addiction, but what we're really interested over time is how do we capture the majority of folks in a treatment process, in a recovery process, and that it takes a lot of different approaches. We also have come to embrace in the addictions field the theory of harm reduction. When harm reduction says that, look, if you do something a little bit less, that's not a good thing, that's a step in the right direction. And it used to be that we thought, well, look, if you don't stop drugging, you know, if you're using heroin and cocaine and alcohol and you don't quit that all, that you really haven't changed. Well, we've come to recognize that change occurs gradually over time. And if you make some choices that are in service of these goals of recovery, that's a good thing. And no longer do we beat people up for having slips. We recognize that that's a part of the recovery process. We try to learn from those. We also suggest to individuals that there are ways in which their own choice-making process is affected by the drugs, and that they need to appreciate that they need someone outside that can hold a mirror up for them to help them get out of the quagmire they find themselves in. It's very tough when you're using drugs actively, and we know the effects that can have on thinking. It's real tough to figure this out on your own. Hence the importance of group work and being a part of a therapeutic environment.
Okay, but you're also talking about the nature of the illness as chronic, that to some extent we really need to expect and anticipate relapse.
Correct. It's a key part of the recovery process, and that we plan for, not give permission for, but we plan for relapse as an event so that that individual doesn't have to go back to square one in recovery, but really can sort of regroup rather quickly, not experience the losses that can come with slips so extremely, and move forward.
But that really requires a non-judgmental attitude.
Correct. We really want to be clear that when an individual has trouble, makes a choice around use, that they ought to come into treatment then. It's not, we're not going to, when they come to the door, shake our fingers at them, tell them that they're no good. We're going to suggest that we understand the disease process. You happen to be in the middle of this slip, and we're really going to be your partner in minimizing the damage. Okay. Well,
we're going to stop right there and take a short break, and then we'll be right back with Mental Health Matters.
In nature, we see reflections of our children. The tree is the strong one, the ocean rambunctious and untamed. Like our children, each brings something wonderful and unique. They add color, they bring life. And to choose the sky over the water would be like choosing one child over the next. EarthShare, the world's leading environmental groups working together. To learn how you and your employer can help, visit our website.
This is the story about a group of kids who volunteered.
Doing something nice for someone. We fixed stuff. Did some art projects with the kids. We fixed up his house. We worked in the woods. Cleaned up the park.
Did something for the planet.
We just did it. No other reason.
And you know what? It was great.
At first, they didn't know each other.
Well, that didn't last long.
This guy is really funny.
Me? Ace are my
new friends. Are you into it?
Call 4-H or check out our website at areyouintoit.com.
Welcome back to Mental Health Matters. I'm Edgar Wiggins, your host for this program that's dedicated to providing you with practical and useful information about mental health issues and needs. We have as our guest today Dr. Fred Osher, who is the director of the Center for Behavioral Health, Justice, and Public Policy, is an associate professor at the University of Maryland School of Medicine, and also is formerly with the National Institute of Mental Health. Dr. Osher has been talking with us about the really complicated issues of substance abuse, addictions, and the mental health implications for that, as well as some of the things having to do with our criminal justice policies. So let's kind of get back to where we were. You were describing an approach to the treatment of substance abuse and addictions which actually plans for relapse.
Correct.
That this is a chronic disease, and that often people relapse as they would with any chronic disease. So that if the person has a relapse, has a slip, whatever, and they appear